Welcome to Healthcare Cares, and I'm your host, Trina Boyles. Last week, I spoke to you about Medicare. Now, this week, we will be going over Medicaid or Medi-Cal. Nowadays, everything's called Medicaid. So when you hear that term, no, it's the same as Medi-Cal. Hit me? All righty. So, who's eligible for Medicaid? So, I've heard the term used, poor people. I don't like that because people with low income, not poor people, qualify for Medicaid. Now, back in 2008, we went through this big recession, people being laid off their job, don't know what they're going to do with their benefits. They have these illnesses, they have newborns, they have children that need to be taken care of. Well, I found out from a couple of my coworkers, hey, they went straight to the Medicaid office because they cared about their children's health. Now, some of them told me, hey, I wasn't qualified for Medicaid, but my children were. Good thing. Because a lot of when you get laid off, you're offered this COBRA plan totally out of your budget. So you're saying, Now, I say back in 2008, low income, not poor people. People who have a low income, okay? So, also, the guidelines under Medicaid, you must be a U.S. citizen of the United States, or you live in the state and you are a resident of the state for 5 years or more. Okay, so last week I spoke to you about that Medicaid, Medi-Cal, Medicare. Okay, here we go. So people over 65, over 65 qualify for Medicaid. Medicaid will handle, even if you have Medicare, you will qualify for Medicaid. Medicaid is good. Skilled nursing facilities, home health, those things. And you can check it out, find out. Because you do qualify for Medicaid even if you're older than 65. People who are disabled, blind, they qualify for Medicaid. People, again, over 65, nursing homes. Sometimes you may have to put your parent there, or sometimes you're young, beautiful, out running, healthy. God forbid you have a stroke and you have to go in a nursing facility. And you say, I work, my benefits are not going to cover them. Contact your Medicaid office. That nursing home will come in to play big time. Home health is another thing. You need someone to come out, help you bathe, take care of you, and you're under 65, but you need these things done. So you go down and you enroll in Medicaid. Now, Medicaid is what we consider a split state, local, and it's a federal program. So as I speak to you, yes, I'm in California. Okay, we love it. So as I speak to you, we're talking about Medicaid. Check out the state that you live in. Find out if you are eligible for Medicaid. State laws will vary. So I ask you, check the state that you live in. Okay, also another qualification for Medicaid, you're a single mother and you have children. you have lots of children, or maybe only one, you can go down. Medicaid will help you out. Now, if you're employed and you got these benefits and you're making great money, you may not qualify for Medicaid. So, not all pregnant women qualify for Medicaid who have children. Now, people with disabilities, you have a child that's born blind, have autism, cerebral palsy, MS, multiple things, what they consider a disability. Go to your nearest Medicaid office, sign up, and ask those questions. Now, you have to remember, you have to meet the income requirements because not everyone qualifies for Medicaid. So you go in and you say, hey, I work full time. I'm making $50,000, $60,000, $70,000 a year, and they turn you away. You have to understand, you may not be that person at the top of the totem pole because there's other people, low income, disabled, and they need Medicaid. As I stated, it's a federal program. You also can enroll in Medicaid if you suffer from HIV, AIDS, even if you're over the age of the Medicaid qualification or over the age. See, Medicare can stop at the age of 21 when you're living with your parent. Some states, 18. So you go, okay. I've been diagnosed with HIV. I have a kidney disease. I have breast cancer. And I'm not 65 and over. What do I do? Go and sign up with Medicaid. They'll say, are you able to work? Nope, I can't. But I need to keep up my health. These are we consider chronic illnesses, long-term illnesses, and you need the help. And you say, okay, this is where I go. Don't be ashamed to go into the Medicaid office because you are wondering, who's going to see me? What are they going to think? I'm a poor person. I can't afford to live on my own. I don't have the money. When you're that sick, you may not be able to afford to get private insurance. And that's why we have this Medicaid program, which is so important to lots of people out there. You have a student going to school and they're in college. You don't know what to do because, hey, my son is over the age that requires me to qualify him or her for Medicaid. You can ask that student, your son, your daughter, hey, go down to the Medicaid office, find out what they can do for you. Hey, you want them to stay healthy in school, you want them to pass, you want them to graduate, get their multiple degrees or the degrees, and live a happy life. So there are some qualifications, even when you're in college. You may need it. You may go into college with a chronic disease. Always check it out. I will say, if you don't know and you want to know if you qualify for Medicaid, go down there. Go to their website. I will also put that website on my Facebook page. I will also put that website in an email to some of the people that I've sent out, or you can send me an email, healthcare.cares, CARES. Yes, healthcare.cares @gmail.com. Send your questions to me about Medicaid. You're not for sure. Yes, they do have websites. And as I explained last week, Some people do not like computers. Some people don't even know how to turn on a computer. Some people don't know how to navigate on the computer. Some people are waiting for the kids to come over and show them how to work it, or their grandkids. There's other ways you can get this information. You could always, hey, hit me up on my website, hit me up on Facebook. My website has the information at the bottom on how to contact me with your questions. Make sure you leave your email address so that I can respond to you. Now, there are services that Medicaid just don't cover. What are those services? Okay, you're a breast cancer survivor. You're vain, or you're a woman. That's just all to it. And you want that reconstruction surgery, and you haven't gone back to work, so you don't have private insurance. Okay, that's something Medicaid will not cover. I feel bad for them. But there's other places out there. There's other nonprofit organizations that you can look into that may cover that reconstruction surgery. I know as a woman, I want to feel whole. I want to be that woman who loves herself and her body. Okay? Also under Medicaid, and this is something that has been brought up many, many, many times. So many times. Mental health services. Medicaid will cover it. You just want to know, how do I know? What do I need to do? What do I need to look out for? Well, hey, I got a treat coming for you in a couple of weeks. I have a doctor, PhD. He'll be my host. He'll be taking your mental health questions. He'll be able to relax you. I'm not a medical doctor. I can't diagnose it. I can just only tell you about the coverage that you can get. There's so many people walking around out there with these behavioral problems, mental health problems. I feel for them because some people are not even aware. They don't even know what signs to look for. So I asked this doctor, hey, I need your help. I need you to come in. I'm going to have a segment on mental health, and I want you to be there to answer these questions. And I'll also let you know, you have questions on mental health, email me so I can give them to the good doctor and he can respond to some of your questions. Now, Medicaid also covers dental and vision. Medicaid is somewhat, how can I say this? They have their own doctors, just like a private insurance, that they contract with for vision and dental. So don't just walk into a dentist's office or make an appointment or walk in to have your eye exam because you need glasses. Don't do that. Call that number on the back of your card. Ask them, where can I go for my dental care? Where can I go for a vision examination? Where can I go for new glasses? I need them really bad. You see me, I have my new glasses on and I'm here. So I'm able to talk to you and read off my little cheat cards. But Medicaid will cover those benefits for you. You don't have to suffer in silence with toothaches or trying to read a book and you can't see it. And the question in your head or your thought process is, I don't have any benefits and I cannot afford a vision exam or glasses. I have a bad toothache. I don't know what to do. My son's been crying all night because his tooth is hurting. And you have Medicaid? Call. Let them know, hey, who can I take my son to? Who can I go to for my dental care? Medicaid will give you a list of doctors. If you have access to a computer, You can go on their website, find a doctor, find one nearby your house, find them. Now, with Medicaid, a lot of times you'll make that appointment and you'll say, hey, what's your insurance? That's the first thing all the time, even when I call in. I've been in this industry for over 30 years, and people will still say, which health plan are you covered with? Do you have insurance? And you'll say, yes, I have insurance. I have Medicaid. Now, don't feel bad when we're not accepting Medicaid patients. But your name is in the provider directory for Medicaid. Well, we're not accepting them. I've heard people tell me over and over and over again, I call these doctors and they're all telling me no. They don't cover the dental. They don't cover the vision. Or I can't even go to a doctor for my preventative care checkup. They'll tell you that. You call your Medicaid office. Call them. They have customer service numbers right on the back of your car. You explain this to them. And be able to tell them, well, I went to Dr. A, I went to Dr. B, I went to Dr. C, and they all keep telling me, hey, we don't accept Medicaid patients, but yet they're in your provider directory. When you need that kind of help, check out that 800 number, 877 number. Some have 855 numbers. Call them. Let them know. You deserve to be taken care of. Your children deserve to be taken care of. I would want my babies taken care of. They're adults now, so they take care of themselves. But you as an individual, you and your family deserve to be taken care of. And it's not because you're poor. I don't want to hear that term being used. You have a limited income. You have low income, which qualifies you for Medicaid. Don't worry about it. Don't worry about it. What is important here is that you go and get that card. Take care of your family. Make sure your family is healthy. Make sure your children are getting their shots. Make sure your preventative care is being taken care of. Just because you don't have private insurance, hey, it does not matter. You deserve what everyone deserves. Everybody deserves to be able to take care of their health. Taking care of your health in the beginning prevents long-term illness. You don't want that to happen. I wouldn't want it to happen. So what do? You go and find out, what can I do? I tell people that all the time. And as I stated in my previous podcast last week, my qualifications. I've been in this industry for so long. I receive so many calls and emails asking for help, and I've done it. But my goal is to get the word out to everybody. So what's the best way to do it? YouTube and this podcast. I came here. This is the very best thing I could have ever done in my career. I have a passion. I will be your community advocate to help you navigate through this healthcare, Medicaid, Medicare, red tape. You deserve to be taken care of. Your children deserve to be taken care of. So, when you go to a Medicaid doctor, I've heard this before also, this doctor's rude. He acts like he don't like me. I don't know what to do. My goal here is to empower you. Empower you to work with your provider for your healthcare delivery. Do you have to stay with that provider? No, you don't. There's something going on. You don't like his personality. Maybe he don't like yours. You're questioning the type of care you're going to get. Hey, go find somebody that'll help you out. Go back to that directory. Find a doctor where you don't clash. You're getting the help that you need. I'm empowering you to do that today. Take care of yourself. Doesn't matter if you have private insurance, Medicare, Medicaid. I am here. Medicaid, make sure your children are taken care of. Make sure they get their shots, or make sure they get the care. They got a cold. They got the flu. Be that person that's very conscientious about the healthcare needs, and you can get it even if you're low income through Medicaid. Go out there, look for their qualifications. Know, what can I do? How can I help myself? How can I help my children? There's ways out there. Hey, you have to do it one day or another. Don't be embarrassed. You're going to be embarrassed the next time you get sick. You're going to be embarrassed because you're not working and you have breast cancer. Your health is so important. And you have these benefits out there. You have it all out there. It's there. You just got to reach out and grab it to take care of your needs. So I'm here and I'm going to sign off right now, but I'm going to tell you I love you. I love you because you care about you. You care about your children. Take care. And hey, I want to thank Cheryl and Patrick Kemp for that ghetto intro music to get you sparked up and ready to go. I wanted to thank Miss Felicia Morris, who taught me about podcasts. And I'm going to keep right on going. I have many more subjects to cover. So look out. I'll be back next Wednesday at 3 p.m. Take care.